Confident that we will get it right this time round, because I think there has never been this level of consultation. I know Anne has said here, you have stayed in Nairobi, some of you, just to work on this thing and make it happen. New place and a new mechanism of delivering health are very serious. We all know statistics show this jigsaw around health for the last almost 15 years, 2017, 18, 20. And it requires the concerted effort of all of us on how not to do it. You know, they say we need a legal framework that will support it. And that is that, on that issue, I know she has talked to many of you to transfer and transit.
Is the quantity of county headquarters and the confirmed quantity to county head of the 100,000 kits or medicine.
Please leave the county headquarters for the last month.
Yes, thank you.
It's never happened like this in Kenya. So many Kenyans have never been visited at home by a health professional of some sort. And the screening that has been done has really helped.
31st August 2024, as you can see, the counties are listed from the shift. So we kindly encourage you to register and license. Let's encourage and sensitize households, and again, leveraging on other platforms and definitely your support is greatly appreciated. Again, implementation of the county return to work formula.
NHIF currently owes counties about 8 billion shillings.
You have constituted a team. Does it include the counties? Very good. The team has already been constituted.
Payment solution and also monitoring the CHPs. And as agreed with
of the Kenyan people as a focus and at the center of our conversation, that as we sort out your NHIF bills, that's the price we pay for being a democracy. We just have to, continue. I must comply with the tariffs that we have set up for them, and we are looking at placement, we are looking at fees of post service. We focus our attention on UHC. So we have tried using the legislation we have.
Based violence being seen as emergency. We want to end, maternal. We have an issue with, especially like underage cases. Lastly, Your Excellency, on the ICHIS module, we're getting a lot of cases of mental health issues. I'll give an example. Nairobi Funeral Home, we would get maybe maximum 10 cases in a month. Now we're getting 30 after April. We want to use our CHPs to look at these indicators at the lowest level onto the ICHIS model. During COVID, there were psychiatrists and psychologists who had been deployed by the ministry. Now they're back at the national level. I think it's something that we should not ignore.
Thank you, Excellency. And also, they may need to involve the county governments a little bit more in this, because this is a health function. I think also there's a disconnect because sometimes we seem to be working in silos. The indigents, Your Excellency, reside in counties, and therefore county governments are best placed to identify them. We are also proposing in our recommendation that the county governments identify the indigents. The payment of indigents is factored in the national government budget. And then, Your Excellency, to support public health facilities, it is also important that all indigents paid by both the county governments and the national should be capitated in public health facilities so that that money does not go to the private sector. Your Excellency, on the Comprehensive Integrated Health Information System, we noted that despite the Digital Act and attendant regulations being in place, counties are still facing challenges in effecting digital transformation, with majority of public health facilities not having ICT infrastructure, reliable power, connectivity, and access to fiber optic internet. And this will impede, Your Excellency, the health facilities' abilities to utilize a digital superhighway, including claims to SHA. Our recommendation is that to implement the Digital Act, the county governments require financial resources for the procurement of ICT equipment, systems, human resource, and running costs. And also, they enable state departments to fast-track support and ensure all health facilities are connected in the last-mile connectivity of electricity and fiber optic and proper access of roads. I think we had talked with them and they had said that they are actually dealing with that aspect.
It is very important that each and every state department and ministry that is supposed to play a role apply their mind and pay attention to what they are supposed to contribute. Because this is a very big program. It involves not a section of Kenyans. It's not about farmers or about teachers. It is about the 55 million Kenyans. It's about everybody. So it is that important and it is that serious. So to all of us, you know, we need to mobilize society to understand what it is that we are trying to achieve. Communication is going to be very important. Like, for example, just listening to what we have been talking about here, what kind of communication are we going to be giving to our Ngao and CHPs? Why should a Kenyan register? Yeah? We need to be clear why they should register. They should register so that each one of us can access health. For those who can afford, then they will be in the scheme. For those who you need to register so that if you cannot afford, the government can then budget to pay for you. That's why you need to register. You need to register because when your child goes to school, we want every child covered. We want every child's medical attention to be provided. But you have to register so that your child is captured. You know, by registering, you will register together with your family. And then, so that when your child goes to school, they are in the system for them to be covered by government and by the health services that we are providing. So we need to be basic but very clear so that people know why they have to register. The people in energy and the people in ICT, those hospitals that have no electricity will not be able to run some of the facilities. Many facilities require energy. So where there is no electricity, we are asking the Ministry of Energy to provide solar connection. Where there is no internet, because we are now going to deliver this on a digital platform. Where there is no internet, let us use satellite to make sure that we deliver internet in those areas so that every part of Kenya is covered. For all the other departments that are supposed to play a role, go out of your way. You know, the Ministry of Education should mobilize students so that they become part of the registration process and making sure that we don't leave nobody behind. So indigents, Ministry of Finance begin to internalize what is the budget outlay, what are the priority areas, what do we need when, so that we can provide for that service. The people in citizen services, all people traveling to Kenya must be covered, so that the health insurance cover for people traveling to Kenya, which is already in the ecosystem, should now be brought into place, so that if any person traveling in Kenya becomes sick or get involved in an accident, there is a mechanism for them to be treated without necessarily as incurring unnecessary expenses. They should be able to be covered by the cover they are going to get. So this is a whole of government approach. I'm very happy with the progress that has been made, but it is not done until it is done. And 1st of October, it is. As we all know, health is a big component of what affects the people of Kenya. We have committed ourselves jointly between the national government and the counties on collaborating on this very important subject that is otherwise devolved to the counties, but that requires our collaboration and working together, because matters health are very serious. We all know statistics show that close to 1 million people every year go into bankruptcy because of hospital bills. We also know that we spend a significant portion of our budgets, especially at the counties, on matters health. And we as a nation, we've been trying to resolve this jigsaw around health for the last almost 15 years. I remember in the Grand Coalition government, when Professor Anyang' Nyong'o was our Minister for Health, we had a go at it. We had a go again when Charity Ngilu was Minister for Health. We again tried with the Jubilee administration in 2017, 18, 20. And we ran into a lot of difficulties. I remember one of the counties that was the pilot was Nyeri, and we ran into a lot of problems. And we had to announce that this thing has failed. So and it was something that I was very passionate about, because if we can solve this question of health, then we will have solved one of the very big problems we've always had as a country. All of you remember that the many harambes we used to hold in the past was for school fees. But after what we did around education, that problem has, there are no more harambes anymore about school fees. They are very, very exceptional situations. The only problem that we still have is harambes around matters health. And that is why it is important for us to solve this health puzzle. And it requires the concerted effort of all of us. I remember very clearly asking Mahmoud here to be the chair of NHIF, because I wanted to do some work around it. And he did a wonderful job in NHIF. But we couldn't get it quite to the place where we wanted it to be. And learning from the experiences of what we did in a Grand Coalition government, what we did as the Jubilee administration, we've gathered a body of experience on how not to do it. You know, they say, when somebody tries to do something, if he succeeds, he achieves what he's doing. If he fails, at least he has one lesson, how not to do it.